Hi, my name is Avery Lamb, and today I will be talking to you about rosacea. So, throughout this presentation, I'm going to cover what rosacea is, what it can feel like for different patients, major body parts that are involved, the etiology of the disease, risk factors and triggers that have been identified, treatment and protection for rosacea, and two interesting facts that I learned. So, rosacea is a skin condition that is chronic but treatable. It technically can develop at any age, but majority of people begin to see it around the age of 30. It's characterized by flare-ups and remission periods. It affects the epidermis of the skin, which is the top layer of the skin, and it is known to have intense erythema, which is a facial reddening. It can feel different for each patient. Some people may experience pruritus, which is an itching sensation. It's also been seen that many people that have eczema and its related symptoms can feel the same way about their rosacea. And the flare-ups can feel hot internally and to the touch, and or a burning sensation may occur. So, the major parts of the body that are involved, it tends to primarily affect the central area of the face. However, intense and untreated cases can lead to the eyes and the nose being greatly affected. It's specifically seen in men that the nose can grow enlarged and bumpy due to excess tissue, and the eyes can become irritated and look bloodshot if it spreads. So, for the etiology of the disease, while research is being done and a lot of risk factors have been identified, there is no clear cause to rosacea at this time. So, the National Rosacea Society has listed a bunch of triggers online, which I've listed only the most common ones here, and they've uncovered a lot of the risk factors that are included. So, some of those include genetics, overactive immune system, and they stated that while everyone is susceptible to rosacea, no matter skin type or skin color, fair skinned individuals who blush or flush easily are at a higher risk of development. And rosacea is diagnosed more frequently in women, but it is seen to be more severe in men. Also, neurovascular dysregulation and Demodex mites have been seen as risk factors, and while the Demodex mites sound scary, they actually exist on pretty much everyone's skin right now. However, it has been seen that rosacea patients have a higher amount of these mites on their skin, so that is being looked into as a potential higher risk factor. Now, some of the triggers that have been identified include hot temperatures, sun exposure, emotional stress, wind, heavy exercise, alcohol consumption, spicy foods, cosmetics and skin and hair care products, cold temperatures, medications, and humidity. While this is not an all inclusive list, these have been seen as the most common triggers for a flare up of rosacea. For treatment and protection, it greatly varies from patient to patient because the severity of rosacea can range. There are oral and topical medications that can be taken. Anti-inflammatory medications and treatments, when in remission, have been seen to help keep away the flare-ups. Medical and surgical devices like lasers or intense pulsed light sources can be used if they're seen appropriate for the level of rosacea and the type of skin that the patient has. Specific skincare routines that are safe for rosacea skin have been seen to also help with the sensitivity, and lifestyle management, which is just keeping control of the triggers that you expose yourself to try and prevent flare ups. On this picture here, you can see a before and after of somebody that has been using a topical medication for their erythema. Two interesting facts that I learned while researching rosacea were that rosacea, while it causes obviously the flushing of the sensitivity to the skin, it can also cause the skin to thicken, primarily around the nose, which this can lead to a case of rhinophyma, which can then turn into facial disfiguration and insufficient airflow through the nasal canal if not treated. And rosacea can actually be separated into four different types of categories. We have the neurovascular rosacea, which is the one that you're most commonly associating it with. That's the persistent erythema and the visible blood vessels in some patients on their face. There's inflammatory rosacea, which has the papules, which are bumps, pimples, and plaques, which are raised red patches, along with the redness seen in neurovascular rosacea. Then the phimosis rosacea is the inflammation and the skin thickening, especially around the nose. And then ocular rosacea is when it spreads to the eyes and it causes a bloodshot appearance and irritation. Here are my references, and thank you for listening.